Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about labor and delivery nurses, specifically what they do, how to become one, salary information, and a little bit about what they like and dislike about their job. So first of all, what does a labor and delivery nurse actually do? Well, they assist with all areas of delivery, including administering Pitocin, which is a drug that helps speed along the birthing process. They will also administer pain medications or other medications that the mother may need. They usually don't give epidurals because those are usually administered by the CRNA and or anesthesiologist on duty. They will do things like monitor the fetal heart rate and vital signs. They will insert Foley catheters or start IVs. They will check for cervical dilation and fetal engagement. They will also monitor for general abnormalities. Now, the doctor is the individual who usually delivers the baby in theory, but in practice, actually the labor and delivery nurse will sometimes have to deliver the baby. And when my wife and I had our son a couple years ago, we were talking to the labor and delivery nurse, and she said that she has delivered several babies because it was just literally coming out so quickly that the doctor could not get there fast enough. So you may have to deliver a baby or two or more throughout your career. Also, you have to keep in mind that labor and delivery nurses, they have two patients at least all the time. They will have the mother and the child. And in the case of twins or triplets or whatever, of course, they'll have to deal with those too. Now, how do you actually become a labor and delivery nurse? Well, if you want to become a labor and delivery nurse, first you have to have your high school diploma or GED equivalent. Then you have to apply to nursing school, and you will have to get either an associate's degree in nursing, which takes about 2 to 3 years, or a bachelor's degree, which takes about 4 years roughly. And once you get that degree, you are eligible to sit for the NCLEX RN exam. That's the state licensing exam. When you pass that, you'll be licensed to practice as an RN in the United States and your state. Now, if you want to become one, you have to apply directly to a labor and delivery floor or area because, you know, they will provide on-the-job training once they hire you in. Now, I would point out that labor and delivery nurses is one of probably the most popular areas of nursing because these nurses love their job. It tends to have a very low turnover rate, so they don't tend to quit their jobs very often, and it's quite competitive. You don't see a lot of openings in most areas, but you can definitely get into this area. What I would recommend is while you're in clinicals, talk to your clinical instructor about it, try to get some placement in some labor and delivery areas, and then really network and try to prove yourself while you're there. Maybe you can get your foot in the door and begin working in this specialty. Now, how much money will you make? Well, registered nurses in general, according to the Bureau of Labor Statistics, earn an average of $33.55 per hour or $69,790 per year. Now, that's a nationwide average. If you want the individual breakdown for all 50 states, I'll put a link down in the description, and you can check our registered nurse salary article on our website, and it'll show you that information for all 50 states. Now, they don't break up salaries by specialty on the Bureau of Labor Statistics because really there's not a huge discrepancy between one specialty and another in most cases. Some areas like the ER, for example, you may get critical care pay and you may make a little more, and you'll make more depending on which state, the state in which you live and the industry in which you work. But generally speaking, all registered nurses are going to earn roughly the same if they work in the same state and the same industry, even if it's like a labor and delivery or a cardiac nurse or whatever. So that's approximately what you could earn on average over time. Now, what does a labor and delivery nurse tend to like about his or her job, and what do they tend to dislike about his or her job? Well, the first thing that they would tell you that they like is that generally it's a positive atmosphere. People are happy. It's one of the most happy times of your life, having a child, generally speaking. And you have family coming, and it can be a really like, wow, awesome atmosphere. Also, that is such a life-changing event. I mean, if you think of one of the biggest life-changing events throughout your whole entire life, having a baby has to rank very close at the top, if not the very top event, along with getting married or whatever else. So they get to actually sit there and share that with those families, and they tend to love that, and they eat that up. And then finally, of course, most labor and delivery nurses love babies. And I think that is basically the heart of this specialty, is that you just love children, you love babies, you love to see them birth, and you love the whole pregnancy process. So that's what they tend to like about their jobs. Okay, now what are some of the things that labor and delivery nurses dislike about their jobs? Well, one of the things that they dislike is that they have to witness babies being born addicted to drugs. And of course that occurs when the mother abused drugs during the pregnancy, and that can be a real tragedy to sit and watch an infant child sitting there struggling with a craving or an addiction to drugs. Another thing is that some babies die or have severe complications, and of course they can relate and empathize with that mother, and it can be very emotionally hard to deal with as a labor and delivery nurse, because you form little attachments to families and mothers, and to see a loss after the family was excited, that can be a real heartache. And finally, it can be stressful sometimes, because let's say you have a whole bunch of babies being born. Like when my wife and I had our son, they weren't shorthanded per se, but there were 10 babies born, which is way more than normal that night. And the doctor was literally running back and forth to every room. The labor and delivery nurses were trying to cope the best that they could. So it can be complicated and stressful, because everyone's having a baby at one time and it's coming and something has to be done. So that's the worst thing, or the thing that most labor and delivery nurses dislike about their job. So I hope this video helped you out. Thank you so much for watching. Please consider subscribing to our YouTube channel, and have a great day.